Hi, my name is Dr. Rael Gilchrist, and I've been a licensed chiropractic physician since 1992. I've been blessed to be in the same location for the past 24 years. What I wanted to talk to you about today is the common cause and effects of a simple whiplash type injury. This can range from a significant trauma to a 5 to 10 mile per hour collision. I want you to imagine yourself sitting at a stoplight, listening to the radio, minding your own business, when somebody slams into the back of you. Now, the normal reaction of your head, because it weighs more than the neck, is for the head to hyperextend backwards. Now, what this does is results in the ligaments and tendons of the neck stretching out to their extreme. Like rubber bands, they're going to ultimately contract and whip the head forward again, hence the term whiplash. Now, when you're looking at the human body and you're looking at it from the side, what you should see is a natural curvature of the spine. That natural curvature being a slight reversal of the cervical curve, the thoracic curve, or the upper back as you know it, curving the opposite way, and then the lumbar spine curving similar to the way the neck is curving. That creates a slight S-shaped curve, which allows us to bend, lift, twist, do all the movements that we require on a daily basis without those compressive forces down on those discs. Those discs are ultimately the cushions of the spine protecting the nerves where they come out. Now, if we have pressure on a nerve, that's going to ultimately cause pain. And that's what we as chiropractors are here to determine, where those quote subluxations, which is a misalignment of the vertebrae resulting in impingement of the nerve. We determine where those misalignments are, and we physically correct those misalignments to get to the underlying cause of the problem. As opposed to masking you with underlying medications or ultimately surgery, we're trying to get to the underlying cause of the problem and prevent you from having to go through all that to begin with. So what we're going to do here is discuss a little bit about the cause and effects of this accident. What we're actually looking at here is an x-ray of a young female, 25 years old, who was involved in a recent motor vehicle accident. Now, this was about a 20 to 30 mile an hour collision, so it could have been a lot worse. But before you understand what we're actually looking at, you really need to understand what normals are. So what we have here is an example of a whiplash type injury. Now, here you can see the normal curvature as we had talked about. We had mentioned that when you're looking at somebody from the side that you're supposed to see a reverse C curvature like this. The thoracic spine or upper back is curving the opposite way, and then the lower back is going to be curving very much like the neck, creating that S-shaped curve that we had talked about earlier. And this is what you can see clearly on her x-ray here. So what we should actually be looking at is a nice curvature as this, like you can see here. Here's an example of a pretty severe whiplash injury. Again, the force of that collision has resulted in the head being forced forward, resulting in an abnormal curvature of the spine. So let's talk about the long-term effects of what happens if this goes untreated, or we decide that we're going to go ahead and take some magic pills to get rid of the pain. Ultimately, the pain is going to go away, but the underlying curvature of the spine has not been corrected. Now, what happens over the long term is because of the forward motion of that neck and everything being placed in a forward motion, we're getting an unnecessary grinding effect of bones versus bone. When we start looking at it, you can see from this example here that you've got a nice disc. This disc is about a 1/4 inch thick, and the front part of the disc is actually slightly thicker than the back, which helps promote that natural curvature of the spine. Following a trauma like this, everything now is shifting forward to where the weight is being shifted forward, and any type of movement that we have in our neck, whether we're moving left and right or up and down, is going to create abnormal wearing and tearing in the shape of those bones. That's going to result in what we call lipping and spurring. This is how you clinically diagnose arthritis. When you see this on an x-ray, you know you've got arthritis. Now, typically speaking, you won't see this until you're 55 or 60 years old, but it also will occur 5 to 7 years following a type of trauma. And in this case, this is the trauma that we're dealing with. So as you can see, as we start to progress with the arthritic changes, the normal disc, which is protecting that nerve, is no longer present. So now you have this irritation of that nerve with simple activities. You might be doing something at home, you might fall asleep on your stomach with your head turned, and all of a sudden it reproduces the pain that you had years ago from the time of the accident. So it's very important that we get to the underlying cause of this problem and try to promote that curvature back to normal, which will then in turn allow these muscles to relax and allow the body to do what it does best, heal in a natural fashion without masking the pain with any drugs or surgeries. And that is what we as chiropractors are trying to achieve. So as you can see from the x-ray, a simple rear end collision has resulted in a complete reversal of that normal cervical curvature. Now I want you to imagine the group of muscles that run from the mid back here. They actually insert into the shoulder area and then ultimately insert into the back of the head here. So you got this big muscle group here called the trapezius muscles, named after the shape of the muscle. So I want you to imagine what's going to happen to that muscle group if the attachment is going to here and then up into the head. What do you think is the normal reaction to these muscles? They're obviously going to be in a chronic state of spasm and tenderness. Now, if you've got muscles that are contracting down and they're attaching to the skull here, they're actually pulling down on that skull, resulting in compression of the nerves going up into the head, and that's triggering headaches. So in addition to the localized neck pain or complaints of pain potentially going down the arm, you're also responsible for the headaches. So we're talking about a whole array of symptoms that can be attributed back to the trauma that you're having. So it's very important, again, to try to get that curvature corrected back to normal. This is something that modern medicine just doesn't provide you. We can take pain pills and we can take medications to mask the pain, but ultimately the underlying change in the curvature is going to be there, and it's going to affect you for the rest of your life if not treated appropriately and correctly. Please keep in mind that now, with the new laws in place, you only have 2 weeks to go ahead and get a full evaluation. If you're still having an issue after that and you haven't been treated, the insurance company has a legal right to deny you any further treatments in the future. So do yourself a favor and get yourself evaluated sometime within the first 14 days so that you can document your injuries and that you can go ahead and proceed with necessary treatment. Thank you, and I hope you've enjoyed this presentation.